It's a huge privilege to be talking to you all this afternoon. My name is Professor Jamie Waterall and I work at Public Health England as the National Lead for Cardiovascular Disease Prevention and Deputy Chief Nurse. Now, the work of the Arrhythmia Alliance and the work on arrhythmias and atrial fibrillation more broadly is something that I've followed throughout my career. I started working in the acute sector and established many years ago one of the first nurse-led arrhythmia services. So it's fabulous to be at an event like this today, one where there's huge passion around how there's still room to improve outcomes related to cardiovascular disease and more specifically here atrial fibrillation, but also an opportunity of which we celebrate the successes and the innovation and the great work that we're seeing across the country. So a huge applause and accolade to all our colleagues that have just received awards. What I'm going to do in the few minutes that I speak this afternoon is just set out some of the national picture and the policy drivers that we're seeing coming up over the next year or two, and the opportunity we have, particularly thinking about the work that we've heard passionately needs to continue on atrial fibrillation, not forgetting prevention, because many of these cases of AF we can stop in the first place, but then when people are experiencing AF, that we detect it earlier and we manage it more effectively. But if I start with a wider backdrop, if we think about cardiovascular disease, which atrial fibrillation is part of a family of conditions, we still have a huge amount to do in this country. I think unfortunately there's been a position over recent years that people felt cardiovascular disease was a done deal and that we didn't have more to do. But actually that's far from the actual picture. There's a lot more work that needs to be done in preventing and managing and treating cardiovascular disease better than we currently are doing. So, cardiovascular diseases take up a quarter of all deaths in our country, so it's still a huge cause of death, of mortality, and it's still a huge cause of morbidity. So almost 7 million people are living with cardiovascular diseases across our country, and it costs a huge amount of money for our health and care system. There was almost 7.4 billion pounds spent on cardiovascular diseases by our NHS last year, and it's costing our wider economy over 15.8 billion in managing these conditions. And I'm really pleased to see on the white paper the focus on health inequalities. We know that people living in our most deprived populations are almost twice as likely to die from cardiovascular disease. It's an unnecessary truth and something we still have to tackle. So we still see huge inequalities. Now, tomorrow, Public Health England will be launching a new cardiovascular disease action plan. So you'll be able to see our agency's commitment to cardiovascular disease and the particular focus on prevention. Our Chief Executive, Duncan Selby, has positioned this in one of his top 4 priority areas for the year to come. We feel there's a lot more that needs to happen, and particularly focusing on atrial fibrillation as part of that wider work. Now, we will be announcing tomorrow a number of things that we've done over the last year and a number of things that we plan to do over the coming year. But there are a number of resources and tools that will be helpful in making that case locally, as we've heard our speakers passionately say, you know, we have to go back and tackle this at a local level. So we've just published only last week a new return on investment tool that sets out the savings for our health and care system and social care if we just got better in managing and identifying these people earlier. So that's something that is already available. We published a number of months ago something called the size of the prize, which sets out for England, and breaking it down to local authority and CCG levels, that gap that still exists in people not being detected or being managed optimally. And if I look at those results across all of England, there are huge potential savings and, more importantly, opportunities of preventing or delaying events. So from that size of the prize work, we estimated over 14,000 heart attacks and strokes could be avoided if we got better at treating people who we know have atrial fibrillation and are not being optimally managed. And that could potentially save our NHS £241 million in just 3 years alone. It's not only about affecting people's lives, but this is cost saving at a time that we're having to think about our resources. It's not all a bad picture. There's been significant improvements in atrial fibrillation detection and management over recent years, and there's been fabulous work that's been led by our academic health science network that has really pushed the agenda with a number of colleagues in improving detection and management. The final thing I want to reflect on and thank the AF Association for is joining now a new cardiovascular disease prevention system leadership forum that Public Health England has established, and we currently have 35 different organisations around the table representing our wide system, whether that be government, whether it be local government, our royal colleges, the third sector and the statutory organisations. And I think from what our earlier speakers described in the need for us to work together, to work collaboratively to improve cardiovascular disease outcomes, this is something we're currently working on, and the intention is we will be looking to develop national ambitions for cardiovascular disease prevention, including atrial fibrillation. So as a country, what are we trying to do? Where are we trying to improve outcomes? And we hope to be able to publish those early next year, setting a aspiration for our country as a whole. And alongside that, we now have the new NHS long-term plan, which I believe is intended to be published in December. And for colleagues that aren't aware, the NHS long-term plan has now committed to cardiovascular disease being a new clinical priority. So we have another opportunity, in this case focusing on AF, but many other areas to improve outcomes over coming years. So it's through your leadership, it's through our collective efforts, as we've heard already today, that we really can take our country into a place that people aren't dying unnecessarily, aren't suffering the consequences of what is a largely preventable and avoidable area. So thank you very much.